Have you been unable to purchase medicines or medical equipment? In the modern world, some states or international organizations decide to put pressure on their opponents instead of resolving disputes through peaceful means. By circumventing established rules and violating international law, states impose unilateral sanctions without or beyond authorization of the United Nations Security Council. So, let's take a look at how unilateral coercive measures affect the lives of completely ordinary people from different countries of different ages and genders. Meet Anna. Anna is 30 years old and she suffers from diabetes. To maintain her health, she needs to use an insulin auto-injector before each meal. Today, she decided to replenish her medicine suppliers, but the prescribed insulin auto-injector disappeared from pharmacies. She couldn't even buy it from the internet. Due to sanctions, delivery of this specific medicine is unavailable to her region. Meet Seth. Seth is 10 years old, he is from Yemen, and he likes playing games with his classmates. Unfortunately, today he stayed at home due to high fever. Cholera cases have become more frequent in his village. It would have been easy to cure if there had been antibiotics. Unfortunately, due to sanctions, his village can't afford even essential medicines. Seth already has first signs of dehydration, and his mom is very worried. Meet Madame Kiambe. She is 80 years old, she is from Congo, and she had a heart attack yesterday. She is currently in a critical state. At the hospital, she was placed on a medical ventilator. However, the hospital's equipment is dangerously old, and it's almost impossible to buy the new one due to the impact of unilateral coercive measures. Even if Madame Kiambe survives, she will suffer from the complications caused by malfunctions in the ventilation system. In this video, you saw 3 situations affecting children, women, elderly people of different ages and nationalities. However, there are millions of similar situations all over the world. As a result of the lack of food and medical services, more than 565,000 people die annually due to the negative impact of sanctions, 5 times more than the number of war victims. Thanks to the work of the United Nations Special Rapporteur of the negative impact of the unilateral coercive measures on the enjoyment of human rights, Alena Douhan, a new monitoring platform for assessing the impact of unilateral coercive measures was created in 2024. This is a universal and confidential mechanism that collects data on the humanitarian impact of sanctions from states, international organizations, research institutions, and individuals. Unfortunately, sanctions affect all states in the modern world, both developed and developing, and also affect all segments of the population, regardless of their income, gender, age, religion, citizenship, and the place of residence. We should be aware of the existence of unilateral coercive measures and the consequences, in particular, the negative impact on the right to health.